And now I'm going to introduce our next speaker, Dr. Richard White. Richard White is Chief of Surgical Oncology in the Department of Surgery, Levine Cancer Institute. He's endowed Chair of Surgical Oncology and Director of the Breast Surgical Oncology Fellowship Program. He directs the Breast Metrics Program and serves as co-director of the Breast and Cutaneous Oncology programs at Levine Cancer Institute. Dr. White attended Cornell University and Columbia University's College of Physicians and Surgeons. He received his surgical training at Georgetown University and served as a fellow in surgical oncology and immunotherapy at the National Cancer Institute.
Well, thank you for that kind of introduction. I also do spend a lot of time in melanoma world. In fact, I'm chair of the disease site working group for melanoma at the Society of Surgical Oncology. It's great to join you, and I want to thank Sam for arranging all this and Asim for serving as host. I will be moderating the next session, and I want to introduce our first panelist, Brittany Lorden. Brittany is one of our occupational lymphedema certified therapists in the Department of Supportive Oncology. She specialized in oncology rehabilitation for over 11 years and has worked both in the inpatient and outpatient settings. We're very lucky to have such a terrific team looking after our patients. And fortunately, over time, we're doing less and less nodal dissections, and my hope is that we can reduce the risk of lymphedema going forward. So, Brittany.
Thank you so much for that introduction, Dr. White. So first, the first question I want to answer is, what is lymphedema? So to kind of backtrack, I like to talk about what the lymphatic system does. So the lymphatic system is a network of lymph vessels, lymph nodes, and lymph organs. The lymphatic system helps to transport lymphatic fluid and helps in infection control. So basically, we have lymph vessels all throughout our skin. They drain towards regional lymph nodes. And these lymph nodes contain immune system cells that help to defend the body from infection by removing bacteria and viruses. So our lymphatic system, we're kind of divided sternum left and right, belly button up and down. And so we have a drainage pattern where we essentially have lymph vessels that drain towards your inguinal lymph nodes in your groin, and then in your axilla in your armpits. So we're divided essentially into these 4 separate quadrants. The quadrants then drain towards the lymph nodes again. So that's the lymph nodes then remove the bacteria and viruses and remove excess fluid. So that's essentially kind of a summary of what the lymphatic system does. Lymphedema is a condition in which there's an accumulation of this fluid in the interstitium. So it causes chronic inflammation and reactive fibrosis of tissues. So skin changes and swelling, essentially. And this is due to the decreased capacity of the lymphatic system. So whenever lymph nodes are either removed or radiation causes damage to the lymphatic system, my best analogy for the lymph nodes being removed is it's like a drain, your traditional bathroom sink. So it's normally drains just fine and is effective. But if there's a little clog in your drain, then it's still able to drain, but maybe not quite as effectively as it once did. So that is essentially what lymphedema is. It's that backed up fluid that just has nowhere to go. And it is chronic and it's progressive if it's not managed. So again, it's the decreased capacity of the lymphatic system basically causes this backed up fluid. Now, lymphedema can either be primary or secondary. Primary is you're born with it, it's congenital. Secondary is usually what we're talking about here in the oncology population. So it's caused by the cancer itself or the oncological treatments. So basically you have a decreased capacity of your lymphatic system and you're not able to drain your fluid naturally. So again, there's no cure for it per se, but there are ways to manage it. So I'm going to talk about that a little bit here, about how you can manage the lymphedema, and then we'll talk about kind of the diagnosis, risk factors, and what have you. So lymphedema management, the gold standard for lymphedema is complete decongestive therapy. So it's abbreviated CDT. So in CDT, there's kind of 4 mainstays of treatment. The first being manual lymphatic drainage, or MLD. So this is a very gentle manual treatment which improves the activity of the lymphatic system, and it reroutes the flow around the blocked areas or the unhealthy areas into more healthy lymph vessels which drain into the venous system. So we basically move the fluid out, and now we have to allow it to stay out essentially. So the second step is compression. So there are typically 2 stages of compression. The first being bandaging, which is using short stretch bandages to help reduce the amount or the swelling in the extremity. And it can be swelling in an extremity in an arm or a leg. It can be in the genitals. It can be the head or neck. Really any body part, but primarily is identified in extremities. So these bandages are helped to reduce the swelling in that extremity so that you can be a more manageable size. Now, some people, again, if we're seeing people earlier and earlier, and sometimes, it might not be very swollen, so that we might immediately go to compression garments, which can be a compression bra, compression sleeve, compression stockings, capris, whatever it may be. So compression garments help you to maintain your current size. So it's not going to reduce the swelling, but it will help to maintain your current size so that you don't progressively get more swollen. So to review, the first step is manual lymph drainage. So you're moving the fluid out of the affected extremity or affected body area. And then the second step is compression. So it helps it to not refill. And then the third step of treatment or management is exercise. So in the context of lymphedema management, that means more movement. So our lymphatic system is hydraulic in nature, so it's pressure-based. So our muscles contracting and relaxing helps the lymphatic system to initiate, to help bring the activity, increase the activity, and it helps to drain the lymphatic system out. So if you have diagnosed lymphedema, you should have compression in place and perform just active range of motion. It could be strengthening, stretching, and it also includes some deep breathing techniques. We do have a lot of lymph nodes in our abdomen. And then the fourth step of management of lymphedema is skin and nail care. So as I said earlier, our lymphatic system plays a role in infection control. So it is very important, since we know that if you do have diagnosed lymphedema, that your lymphatic system is impaired, thus your infection control center is impaired. So it's important that you take good care of your skin and your nails. So that's just to eliminate any bacterial and fungal growth and to reduce the risk of infection. So with that, just as a review, so the 4 steps for lymphedema management are manual lymph drainage. So again, it's a light massage because our lymphatic vessels are very superficial to our skin, so which helps increase the activity of the lymphatic system and moves it to healthy areas to drain naturally. The second step is compression. And so again, that could be bandaging, that can be compression garments, but that helps your affected extremity or body part area to not refill with fluid. So that just helps to maintain your current size. And then the third and fourth steps are exercise and skincare. So again, movement to help initiate the lymphatic system, and then making sure you take good care of your skin so that you don't get infections, because there is a very high correlation between infections and lymphedema. And so you just want to make sure at all costs, if I can bring anything home today, it's just to make sure that you prevent infections at all costs. And so in the management of lymphedema, certainly a certified lymphedema therapist will educate on all of those components, and making sure that the individual with lymphedema knows how to do manual lymph drainage on themselves, knows how to either bandage themselves or don and doff the compression garments, and making sure that they have a good exercise program and that they are educated on skin and nail care. Now, going back to lymphedema and kind of risk factors and the diagnosis. So the signs, as I kind of talked about previously, is swelling is probably the biggest indicator. A lot of people have a sensation of heaviness or tightness. Sometimes swelling, usually if it's around joints like elbows, shoulders, knees, you might have limited range of motion or movement. You might have some achiness, or infections, again, are a big indicator and correlator of lymphedema. So the way that we diagnose it is usually just clinical symptoms, medical history, and we take measurements. So there's a lot of different devices that can take measurements. Kind of the gold standard is using a tape measure and using landmarks in many areas of the extremity to diagnose. So for instance, if you have swelling in one arm, we would measure both arms. And if you have a 2 centimeter difference between your affected side and your unaffected side, then that is clinically significant for lymphedema. There are devices that help basically measure the volume using lasers. There's new devices that use iPhones and to help measure. But basically, again, the gold standard is using a tape measure to see if you have 2 centimeters difference between your affected and your unaffected side. And of course, clinical symptoms and medical history. Lymphedema typically presents within the first 2 years following treatment. However, it can occur at any point, depending on whether you have radiation or a lymph node dissection. And as Dr. White said previously, with axillary lymph node dissections not really occurring quite as often, fortunately, the numbers of lymphedema cases are decreasing, as axillary lymph node dissections are a risk factor for lymphedema. So risk factors have been researched primarily in breast cancer patients and survivors. But really, the most recent research, it was in 2016, and the 5 main risk factors that have been conclusive are obesity, an advanced age at the time of the diagnosis, infections, axillary lymph node dissection, and radiation therapy. And I'd be happy to answer any questions about any other risk factors that you may have heard of in the Q&A, but those are the proven risk factors in the most updated research. And then that basically concludes my my Q&A here. And basically, if you have any symptoms, make sure that you go to your physician and consult with your physician, and make sure that you get a certified lymphedema therapist if you have concerns. But thank you for your time, and thank you for introducing me, Dr. White.
Oh, thank you, Brittany. That's an excellent review, and I really appreciate all you do to take care of our patients. Next panelist I have the great pleasure of introducing is Alexandra Bailey. She's one of our tremendous genetic counseling team. She sees patients with hereditary cancer risk assessment for lots of different indications, including melanoma. So, Alexandra, if we've got you up.
Here I am. Thank you so much for the introduction, Dr. White, and thank you to AIM as well for inviting me to be part of the panel this morning.
Terrific. A simple question for you. What's a genetic counselor? Who should see a genetic counselor? And how do you know what the results mean? And what do you do with them?
Yep. So just starting with the first question, what is a genetic counselor? So genetic counselors are typically master's level providers who've received specialized training in both medical genetics and counseling as well. In oncology, our role is to meet with patients and their families who might be at risk for a hereditary cancer. So in a visit, typically what we do is we review the family history, help do a risk assessment and determine if genetic testing could be helpful for that patient, talk through benefits and limitations of testing and what results could mean. And then we also do help to facilitate genetic testing, deliver those results, and help with determining what next steps are. So for folks, one of the questions is who really could benefit from seeing a genetic counselor, who should consider seeing one. There are certain patterns in families that can sometimes point out that there could be something hereditary going on. So families that have been impacted by multiple cancers, so seeing the same type of cancer in multiple family members on one side of the family, whether that's melanoma or another type like breast cancer or colon cancer, seeing people diagnosed with young ages, so younger than you would expect. So again, for example, seeing someone with breast cancer at 45 or under at diagnosis, or seeing someone with melanoma at a very young age, like being diagnosed in your 20s or younger. Any folks who've had multiple primary cancers themselves, and that can include one person who's had multiple melanomas throughout their lifetime. And then any rare cancers in the family, like pancreatic cancer or ovarian cancer, or of course, if someone in your family has tested positive for a gene that causes a hereditary cancer, then those are all reasons and all things that can point to maybe something going on, and genetic counseling could be helpful to better determine that. I wanted to just kind of briefly mention what I mean when I say hereditary cancer. So we know that by far most cancers, melanoma included, are not hereditary. So only about 5 to 10% of cancer, and that includes melanomas, are truly what we call a hereditary cancer. And that means there is actually a problem in a gene, or what we call a mutation or a pathogenic variant, running in a family and causing folks to be at an increased risk. Knowing if you have one of those genetic factors in your family can be helpful for knowing what type of screening could be helpful for family members, or just medical care in general. So the second part of Dr. White's question was, what can results mean? And so, doing genetic testing or learning if you have a hereditary cancer in your family can be helpful for knowing what the risks are for different cancers, which family members are at risk, and then also, again, medical care, next steps, screening, and knowing what your doctors or your family members' doctors can do to help prevent that. That being said, again, just wanted to mention that typically that only does represent about 5 to 10% of cancers. So, if any of those patterns that I mentioned sound like your family, so again, multiple people with the same type of cancer, you or a family member who've had multiple cancers yourself, including multiple melanomas, rare cancers like ovarian cancer or pancreatic cancer, young ages of diagnosis, or a family member who has tested positive for one of those gene mutations. If that sounds like your family, then I would encourage you to talk with your healthcare team about genetic counseling, and they can help make a referral for you or help you decide if that could be right for you. I did want to mention, if that does not sound like your family, which, again, would be most of the case for most folks, we do know that studies have shown that just having a close family member with melanoma can still cause you to be at a slightly increased risk. So I still think it could be helpful too, if you have melanoma, for your family members, just to make their doctors aware of that. And that way, they can help them know how to do self-skin exams, how to have safe sun exposure, if dermatology could be helpful for them. So again, genetic counseling can be helpful if you have one of those kind of patterns in your family. If not, still a good idea for family members just to talk with their doctors about your history. I'm always also happy to answer any questions that folks have at the end of the Q&A today. Thank you again for your time this morning, and I will turn it back to Dr. White.
Well, thank you very much. Nice summary. What I always tell my patients is, if you as an individual have had 3 melanomas, seek genetic counseling. And if there are 3 first-degree relatives in your family, so your brother and your father, for example, so that makes 3 first-degree relatives, those are absolutely people who should see genetic counselors. And I want to emphasize the importance of seeing a genetic counselor. This is a very, very complicated world we live in right now in terms of genetics. And let's just say that their additional training is critical to understanding who should be tested and what those results mean. So thank you very, very much for sharing with us, Alexandra.
Thank you.
Our next panelist is Lekeesha Miller-Jackson. Lekeesha and I work together. She's absolutely terrific. She is oncology certified licensed clinical social worker in the Department of Supportive Oncology. She leads a team of clinical social workers that really provide excellent psychosocial services to address social, emotional, and financial barriers with cancer care. This is a huge issue right now, and I'm going to ask Lekeesha to specifically address what's the impact of the cost of cancer on treatment. I think the terminology we've really taken on now, which is a serious issue in our country, is financial toxicity. And how can patients navigate financial resources? So if you could help us understand that, and more importantly, help us understand what to do about it.
So thank you so much for that introduction, Dr. White, and good morning, everyone. So the question, what is the impact on the cost of cancer and cancer treatment? So the short answer I'll give you is that it costs our patients their financial, social, emotional, and mental well-being. Not only our patients, but their entire family. And of course, it can also impact their spirituality, which is extremely important for a lot of patients. So that's the short answer. But to go a little bit deeper, I like to talk about the fact that when we hear the cost of cancer, most of us think about the financial cost. And the financial cost comes to mind because we know, like Dr. White said, when people get diagnosed with cancer, we know that it can lead to financial toxicity. Patients can lose their jobs, which in turn leads to losing their medical insurance, which can also impact their housing, transportation, access to food, and other basic needs as well. So we understand that all of these are risk factors and can impact the outcome of patients' healthcare, particularly around cancer. So the approach I like to sort of look at more closely today and sharing with you is the emotional and mental costs of cancer. And the reason why it's so important to think about this in these terms is because the moment a patient hears the words, "you have cancer," it tends to happen in that moment, which is very important to be aware of. We do this work quite often, and we often hear ourselves repeating these things. But when it comes to the patient, they're hearing it for the very first time. When patients describe these moments to me, they say things like, "I felt stuck, my life flash before me, particularly our younger patients, especially our melanoma patients who are just starting out. Sometimes they're thinking about their social life, their dating life. Some people are thinking about their as far as, is this something that I can live? But in that moment, when they hear you have cost of that, often results in anxiety, depression, isolation, which is huge for melanoma patients, fear, shame, anger, and suicidal ideation, which is very high among cancer patients. In fact, around 30% of melanoma patients say that they have significant stress, such as anxiety and depression. So those psychological stressors often are very prevalent with most cancers, pretty much, I could say probably all types of cancers, but it's particularly distressing for a lot of our younger patients who are trying to figure out life. So I'll say that because all of these things can happen in that one moment, and it can last well into survivorship and beyond. Not to mention the additional financial costs to manage those mental health symptoms throughout cancer treatment. Okay, so that's the unfortunate cost of cancer and its impact on our patients and how they're trying to understand how to manage the financial aspect of it. We have patients who come into cancer care with no financial means at all to cover that care. And so my second question, I will get into sort of give you some ideas about how you can navigate that. But for now, I like to even consider that even patients who have gone through this journey, there's some things that come out of this, is that, they can have a renewed sense of self, sort of this fearless new perspective on life, and they can thrive. And some of our patients become advocates and volunteers. And so as much as it's very costly, there are some great returns, some positive returns, I should say, that's worth acknowledging when it comes to understanding the cost of cancer and its impact from a social, emotional, financial, and mental health perspective. And I'm happy to answer additional questions on this in the chat later. Well, not in the chat, but later afterwards during the Q&A. The second question that Dr. White asked is about how can patients navigate resources in an oncology setting? And I'll say the short answer is awareness and self-advocacy. I encourage our patients to always ask this question at the very beginning when they meet with their medical team. Ask this question: what resources are available to help address financial concerns, and how do I get connected? And there are actually 5 things that I like for you to think about and to write down and consider asking or finding out if your cancer center provides these things. Find out if they have a cancer resource center. Do they have social work services? Are there navigation services, nurse navigation services? Do you have financial counselors and patient assistance programs? And I'll go through each one to give you an idea of what these different things can do to support you throughout your cancer journey and managing your financial needs. The first thing is the Cancer Resource Center. They're they provide great educational resources to help you understand your diagnosis. And they're also available to inform you of all the different types of resources available at that center. So it's sort of a hub that you can sort of rely on to get information about what is here and how can you help me access these things. So find out if there's a cancer resource center at your location that can help you navigate. And then clinical social workers. I'm a clinical social worker, and I'm a proud clinical social worker because I understand the valuable work and impact that we have in navigating and supporting our patients through this journey. And what we can provide is counseling support. We can help navigate financial resources, helping to get you connected to things like transportation, temporary housing, when people need a safe place to recover, food banks, as well as foundation grants and funding through community charity organizations as well. We also help provide information for patients who want to access or understand how to access state and federal funds, such as programs such as Medicaid and Medicare, which is huge because, like I said earlier, our patients often, when they get diagnosed with a cancer, sometimes they may not be able to work. Some people decide that they would like to focus on their cancer treatment and not be overwhelmed by having to manage so many different challenges around work, family, and wellness. And so if they end up losing their job, all of these things can have a ripple effect. So having access to a social worker at the cancer center can help you not only manage and process the diagnosis, but also help you to understand what resources are available to you in that setting. And then the third is nurse navigators. I love our nurse navigators. They have a special and unique role in this journey. Not only do they help you navigate your care and plan of care, but they can also help get you connected to medical related resources, such as equipment, medical equipment, as well as prosthetics and things like that. And one of the most powerful, I always say, if you have a financial counselor or someone who can help you review your medical bills, that is key. Because sometimes, we don't know what the financial cost of cancer is when people are facing this diagnosis. They just know that they want to get treatment. So they don't ask the question, well, how much is this going to cost me? Because for some people, the cost is irrelevant to them. It's how are you going to help heal me? How are you going to help me feel better? And so the financial counselors can help you understand your bills, can help to see if you're eligible for repayment plans, charity care, or co-payment assistance programs. They are a valuable resource to our patients. And the final one is our patient assistance programs. It's a prescription assistant program that we have here at LCI, at Levine Cancer Institute. However, if you are at a different location, you can ask, do you have a prescription assistance program? And those programs can help get treatment for medication, sometimes free, sometimes at a discounted rate. But the key is to ask the question. So overall, the key with navigating financial resources in an oncology setting is to first know exactly, that it exists. So you have to know that these things exist. And it starts with asking that first question: what are the resources available to help address financial concerns, and how do I get connected? So even if you don't think that you need it at that time, it's important to be prepared and to know who to ask, where to access these things, and be aware and advocate for yourself. So self-advocacy and awareness are the two keys, I would say, to navigating resources in an oncology setting. And I'd be happy to answer additional questions at the end. So thank you so much for the introduction, Dr. White, and I enjoyed this time with you. And I will turn it back over to Dr. White.
Well, Lekeesha, I think after your talk, everybody understands why we love Lekeesha. She has really helped us with some very, very challenging problems over the years. Melanoma never occurs in a vacuum, and helping really wrap our care, Dr. Amin and my care, with this kind of support is absolutely critical. So thank you very, very much.
My pleasure. Thank you.
Next, I have the great privilege of introducing Danielle Gentile. She's a health service researcher and assistant professor of medicine in the Department of Supportive Oncology. She earned her Ph.D. from the University of South Carolina's Department of Health Promotion, Education, and Behavior. Dr. Gentile's research interests include integrative oncology, social media, and health disparities within the LGBTQ community. We've asked her to talk today a little bit about the internet. I like to say the good, the bad, the ugly. The problem, as I'm sure Dr. Gentile will get into, is the internet can be the Wild West. So why should people look at the internet? What can be helpful, but what are some of the drawbacks?
Great, thanks for the introduction, Dr. White. So I thought we would start with some of the drawbacks and then maybe end on the positives so that we can have a good note to end on. So as Dr. White mentioned, the internet can be the Wild West, and there's a lot of information out there that is directed toward cancer patients. So there may be misinformation out there. Just because you see it on the internet doesn't mean that it's from a reliable source and that it's something that you should take to heart. So for example, there can be financial traps that exist over the internet. You might see advertisements for miracle cures or things that just seem too good to be true. And when they are seeming too good to be true, they pretty much always are. So watch out for those. And if there are products that you are interested in buying to supplement or to support your self-care during cancer and afterwards, I'd advise you speak with your physician and see what things might be worth it and what things are probably without evidence behind them to support you putting your dollars toward that, especially when cancer treatment is very expensive. So along with misinformation, in trying to find sources that are reliable, there are a few key characteristics that you can look for when deciding whether information is trustworthy or not. So if the information is coming from a well-known cancer organization or a health organization, let's suppose it's NCI, the National Cancer Institute, or NIH, the National Institutes of Health, or ASCO, or NCCN, all of these acronyms represent professional organizations that put out information for cancer patients and their loved ones, and you can trust them more than some community organization or other cancer patients, people who just put information out on the internet kind of privately without any cross-checking that information is worthwhile. And so you should also be careful about privacy concerns. So just because you have maybe on Facebook or Instagram, whatever social media you might use, folks can set their privacy settings and share information about themselves. But even though you have those privacy settings turned on, doesn't mean that people who you don't want to see your information aren't going to find it. So maybe you're okay with talking about your cancer experience in an online support community, but you would prefer that information is not known by, I don't know, some other group. Once you put something on the internet, it's basically free game, even if you have privacy controls in place. So don't share more than you're comfortable with the world knowing. And along that thought, sharing your feelings and your struggles, your wins, your attitudes during the whole cancer journey can be really beneficial for your mental well-being and your social well-being. So you might find it helpful to be a part of some of the online social support groups. And you can talk with people who have experiences similar to yours. I mean, maybe folks in your family or in your immediate friend group aren't really understanding about what the experience is like, and you just want to have an ear of someone who kind of is in your same situation. So the social support on the internet can be very beneficial. Along with the amount of information that you can find on the Wild West of the internet, you can find yourself feeling overwhelmed by the sheer amount of information that's out there. And this is called information overload. So you might start going into forums and seeing people post about the different treatments that they have had, different ways that they're taking care of themselves, which cancer centers are the best in their area. And reading through all those pages, hopefully not staying up too late and missing out on your rest, you can get pretty overwhelmed by wondering what's trustworthy, what's not. And again, the answer to that is to always speak with your care team, because they know you the best. They know the circumstances, they know the science the best. So if you ever have something you read on the internet and you're not quite sure, bring it to your care team and ask the questions. Don't be shy. And I also want to suggest that clinical trial enrollment can sometimes be helpful across the internet. So say you're a part of a melanoma support group online. Researchers who are starting clinical trials might be advertising to that group, and you might fit the inclusion criteria to participate. So you might find a clinical trial that your care team is unaware of. But of course, before you think about participating, I'd advise getting in touch with your care team and seeing if they think that that's also something that would be beneficial to you. So all in all, be careful on the internet. You can find a lot of good social support, informational support, but also be careful and know that everyone on the internet doesn't always have your best interests in mind. Not everything you read on the internet is going to be true. So at the end of the day, your best source is always your care team. So thank you for having me. And I look forward to any questions people might have about accessing information or support groups across the internet. So thank you.
Thank you. Lovely summary. What I always tell people is certainly AIM, which is supporting our program today, is a great resource. NCCN.org, which is the National Comprehensive Cancer Network.org, cancer.org, and cancer.gov are three very reliable sources. What I often tell people is when you're done with those, go take a walk, because much of the rest of the stuff you'll see will not really add to what they're showing you.